Our care philosophy in delivering expedient specialty care is really important because we're taking care of patients that don't have access to it in their hometowns or their local communities. To be able to keep families in their communities and not have to be transplanted hundreds of miles away and to have to travel and to be in a place where they're familiar with their surroundings is really important. It allows us to build a trust that we are going to take care of them in their hometowns, in their communities. From a provider standpoint, it's important to actually do the work to gain that trust, to actually put in an investment to make sure that those on the other side feel that you are bedside and not 1,000 miles away. To me, that is the crux of who we are and how we deliver that care.
The concept of break through the screen really references the fact that as a telemedicine provider, we aren't there, we're not present. And so the traditional experience that one has caring for a patient is you walk into the room, you open a door, you sit or stand near the patient, and you begin to have your encounter. And I think those are really probably something that's relatively mundane to those who think about their patient-physician or patient-provider experience. But in telemedicine, we don't have that opportunity. So when we're having a virtual encounter, a telemedicine encounter with a patient, we have to recognize that we have some limitations, right? We're not there in person. So we can't use our hands, we can't say hello with a handshake. We can't, in a difficult situation, show compassion to give someone a hug or hand them a tissue. We lack that ability to use those kind of social norms to establish a relationship. And so break through the screen is kind of a conscious awareness that you as the remote provider have to be very intentional about how you begin to have an encounter, how you kick off the time with the patient, and kind of understand the importance that your background, your surroundings, the quality of your audio and your video really mean and matter to that patient, and that it sets a stage of professionalism, which builds confidence and also begins to break the ice with a patient to begin to build trust so that we can establish rapport.
The next part is actually the investment part. Learning about your patients, knowing their day-to-day ups and downs, knowing their goals, not just immediate goals, but future goals for their health. Finally, seeing patients day-to-day establishes continuity of care. And the fact that these patients and their families are seeing you every day allows them to understand that you actually have an investment in not just their health, but their lives moving forward. Part of breaking through the screen is not just with the patients and their families, but it's also gaining the trust of the total care team, whether it's the nurses, the respiratory therapist, the nutritionist, or even the care team of providers that are on the ground, that they feel that you are going to give the same level of effort and have the same level of investment as they do. The philosophy of every encounter is the first encounter is being able to maintain the same level of professionalism and giving the same sense of investment every single time as if it is the first time you're meeting someone. So it's important to maintain the same level of professionalism every time you encounter a provider or a nurse. It is your job to come out and make sure that they feel comfortable and don't feel uncomfortable that you are providing a level of specialty care that they may not have had before. The goal here is for them to feel that they are part of the care team. The goal is not for them to feel left out or that they feel less than. So as providers, you know when you've actually broken through the screen, when patients look forward to their encounters with you. They look forward to meeting you in their clinic. They look forward to seeing you every day while they're in the hospital. You have families that actually ask for you and say, when is Dr. So-and-so coming by? At that point, you realize that that investment you put in has actually allowed you to break through the screen and touch the lives that you're trying to affect on the other end.
The concept of break through the screen is really how do we systematize and train ourselves to consistently deliver professionalism, consistently deliver excellence, consistently build trust and confidence in the patient so that they feel good about the patient and physician experience, or they feel good about the care that they received, so they have confidence that they're going to get better. When patients have confidence in their care, the provider is professional, the camera angle is right on, that the background is professional, that the backdrop is quiet, that the audio quality comes through very clearly, the camera is high definition. All of those things set the stage for confidence. And when a patient has confidence that the care that they're receiving is not only high quality, but is right for them by a provider who cares, they're more likely to follow the treatment plans. And when they do that, they're much more likely to improve and get better.